in early 2019 in a perspective piece that was published in the New England Journal. You guys knew I was going to quote a journal article. Dr. Megan Ranney, an emergency physician at Brown University, together with her co-authors, responded to a controversy that had erupted on Twitter. 2 months earlier, the American College of Physicians had put forward a position paper in which they recommended evidence-based strategies for reducing firearm-related injuries and deaths in the United States. In response, the National Rifle Association, the NRA, an organization which advocates for liberalizing gun rights, wrote on Twitter, "Someone should tell self-important anti-gun doctors to stay in their lane." Ranney, along with a chorus of physicians and other Twitter responders, wrote with the new hashtag #ThisIsOurLane. They wrote, "Physicians, many of whom are gun owners, quickly responded that the topic of gun violence and firearm injury prevention are squarely within our lane. #ThisIsOurLane calls attention to the role of physicians from many walks of medical life, and it encompasses our other colleagues as well. Paramedics who face carnage in the field, nurses who provide massive transfusions, housekeeping staff who clean blood-soaked floors, pharmacists who assist with ICU medication dosing, and everyone who helps survivors piece the lives back together and helps families recover from their loss. This is their lane too." I was in the ICU 3 weeks ago when the world learned of a tragedy occurring in Uvalde, Texas, where a young man had shot and killed 19 children and 2 teachers at an elementary school. This story felt like deja vu to many of us who grew up in this state. 10 years ago this year, a similar tragedy in both story and scale unfolded only 40 miles from where we were sitting this evening. In the ICU, I looked around the unit at rooms that often were home to victims of gunshots themselves. Thankfully, in our hands at least, never children. I thought about the 50-year-old man I think many of us have had the privilege to take care of, a gentleman who's paraplegic after gunshot injuries 2 decades ago, who returns to the hospital every few months because of severe and unrelenting infections of the hip bone. I thought of the young man I met who was dying of respiratory distress, struggling to breathe and about to have a breathing tube placed, but whose parents we were not allowed to call to let him say one last goodbye. Why? Because he was a prisoner, a victim in a very different way of the way that our society handles guns. #ThisIsOurLane. I mention this tonight because I think tonight is an important moment when it's appropriate for us to reflect for a moment on what lies in our lane right now. Our graduation from resident physician to trained practitioners of adult medicine is an inflection point, even for those of us who are continuing our training in some subspecialized aspect of adult medicine and disease. We are now far enough along that road to truly being doctors, but we are permitted to be independent, and I would charge far enough along that road that we are expected to independently be advocates for the health of our patients. As doctors of internal medicine, are we free to hang up a shingle, ensure that we've properly counseled our patients on their cardiovascular risk factors, prescribed a statin, and we call it a day? Or is the broader health of our society a part of our obligation? I don't know the answer to that question, but I know it's a big one. But let's think about it for a moment. The health of our society, and I don't need to be the one to tell you this, it's not strong. I don't mean to speak in political terms here, and this isn't meant to be about whether or not you share my particular politics and my particular worldview, but I do ask you to take a moment to think about what we've seen over the past 3 years. The health of our society is not strong when we take care of patients who are at death's door from ketoacidosis, because they couldn't afford to buy insulin. It's not strong when hospitals are driven by any number of complex economic forces to minimize the number of doctors, minimize the number of nurses, minimize the number of respiratory staff who can be at the patient's bedside, relying on fewer and fewer of these outstanding staff to do more and more work taking care of sicker and sicker patients, pushed to their limits. And it's not strong. We learned that several states in our country plan to enact laws that would make it a crime to take necessary emergent action to treat even a non-viable pregnancy that is growing outside of the uterus, all with the aim of outlawing any and all abortions. Back in February, not that long ago, NPR reported on the story of a woman who experienced PPROP, that's premature, before-term rupture of the amniotic sac. She had this at 19 weeks of gestation before there was any hope of viability. Unfortunately, she was living in Texas, where abortion, even at 6 weeks, is already functionally against the law. Her doctors determined that legally they could not treat her. She was sent by commercial airplane at risk of sepsis, at risk of hemorrhage, all the way to Colorado, where they had found an accepting doctor. This is not a healthy society. And we are now graduating, trained to be our society's doctors. This is our lane. This is, in the broadest sense of the word, the diagnosis we must take part in treating. It is an enormous task, made no simpler by the political fracturing and animosity that this country now suffers from. But we are used to treating the untreatable. Our primary care clinics, whether they're at John Dempsey, at Gengras, at Brownstone, at the VA, are filled with patients whose problem list resembles this exactly. Our society is like that patient with an A1C of 13%, liver disease from its alcohol use disorder, and on the road to dialysis soon. And we see this patient come in for primary care visits, and as we've been so well taught over these past few years, we ask them what issues are first and foremost on their minds, and then we sketch out the priorities from our perspective. And we set a schedule to deal with at least one tassel on that tapestry of pathology. Maybe we can do a little better at getting their blood pressure under control. I was thinking about my own religious tradition, which has a bit of wisdom that I've shared with a number of interns that I've had the privilege to work with, in a book called Pirkei Avot, which means the wisdom of the fathers, or the sayings of the fathers. We are told that Rabbi Tarfon, who was a scholar in the 1st century, taught it is not your responsibility to finish the work of perfecting the world, but you are not free to desist from it either. We are not free to stop working on getting our patients' hypertension a bit more under control. We are not free to stop working on using evidence-based approaches to make our society healthier from gun violence, from lack of access to adequate nutrition, from lack of access to adequate medical care, from laws that misunderstand how the body works in their attempts to advance their ideological aims. It has been a privilege to share the past 2 years with every one of you. Residents are often compared to soldiers in a foxhole, developing by life or death necessity a great deal of trust in one another. We've had the unusual experience of fighting a disease that did not even exist before we arrived in Hartford, Connecticut. My thanks to each of you for sharing that foxhole with me, for being ready to place a central line, or tell me my ingenious middle-of-the-night plan for my patient with 2 vasopressors was quite foolish. These friendships, which we now share across professional boundaries, as some of us start practices in primary care or hospital medicine, while others of us will spend the coming years subspecializing further, whether it be in care for the heart, or care for the endocrine glands, or caring for the patient with cancer. These friendships should be a source of strength if we are going to take on these bigger battlefields. There's a great deal of expertise in this room, a great deal of energy, a great deal of compassion, and maybe even the earliest hints of wisdom. Let's go forward. Let's do some tilting at windmills. Let's not desist from being good doctors to society, even if it's inconvenient. In the musical Man of La Mancha, a version of the story of Don Quixote, the country squire imagines himself a chivalrous knight in shining armor, and he announces, dare I say it, his quixotic quest in that musical with a song that I'm very fond of. To dream the impossible dream, to fight the unbeatable foe, to bear with unbearable sorrow, to run where the brave dare not go, to love pure and chaste from afar, to fight the unbeatable foe, to strive when your arms are too weary, to reach the unreachable star. This is my quest, to follow that star, no matter how hopeless, no matter how far, to fight for the right without question or pause, to be willing to march into hell for a heavenly cause. And I know if I'll only be true to this glorious quest, at my heart will lie peaceful and calm when I'm laid to my rest. And the world will be better for this, that one man, scorned and covered with stars, still strove with his last ounce of courage to reach the unreachable star.